That's a condition where people experience long-term effects after a COVID infection.
It's happening. Ariane Till and the National Verify team are here to answer some of the most common questions that you've had about it.
Nearly 90 million people in the U.S. have tested positive for COVID-19 since the pandemic began. Some of those people continue to experience symptoms or complications for months afterwards. It's a condition called long COVID. Several Verify readers have emailed the team with questions about long COVID. So let's answer them using these sources. First up, what is long COVID? According to the CDC and the Mayo Clinic, a person is suffering from long COVID if they continue to experience symptoms more than 4 weeks after their COVID-19 diagnosis. The WHO adds that symptoms of long COVID last for at least 2 months and cannot be explained with an alternative diagnosis. So how do you know if you have long COVID? According to Dr. Ilham Masaoudi Powers, an immunology expert at the University of Kentucky College of Medicine.
Unfortunately, there isn't a really good way to test for long COVID, right? It's all subjective and it's all people reporting their symptoms.
So what are some common symptoms of long COVID? The CDC says that many long COVID symptoms are similar to those caused by an acute infection of COVID-19, like joint or muscle pain, diarrhea, or stomach pain. Other symptoms that people have reported include fatigue, shortness of breath, brain fog, and anxiety, according to Dr. Natalia Covarrubias-Eckert, medical director of the post-COVID rehabilitation program at Providence St. Jude Medical Center in California. And finally, do you have to have had a bad case of COVID to get long COVID? According to Dr. Covarrubias-Eckert, the answer is no.
We are seeing it throughout the spectrum.
But Johns Hopkins Medicine and the CDC say long COVID appears to be more common in patients with initial severe illness, though it can affect people who had mild symptoms too. With your Verify, I'm Ariane Till.
We do have some encouraging news for those vaccinated against COVID. There's new data out that now shows that those under the age of 60 who are up to date on their vaccines are very unlikely to become severely ill with COVID. This data obtained from New York State's largest healthcare provider found that 80% of those hospitalized for COVID were over 60. 90% of them had an underlying health condition or they weren't up to date on all of their vaccinations.